Hello, students, and welcome to week one pre-recorded lecture. So each week I'm going to be doing a pre-recorded lecture summarizing the content that we'll be covering. The expectation is that you come prepared to class. Um, and the way you come prepared to class is by reviewing this pre-recorded content lecture. By reviewing each week, I will send out a weekly announcement that will have this pre-recorded lecture. It will also have the PowerPoints associated with each chapter. Okay. And there may be a few other things each week, like a Kahoots or a pre-test or sample questions, NCLEX questions. The goal for this term is that as you come to class prepared, we're then going to be doing student participatory activities during class. Okay, we may be doing case studies, we may be doing, like I said, NCLEX questions, we may be doing Kahoots, and I'll be breaking you out into breakout rooms. You'll be assigned to groups and you'll be asked to complete certain activities and then come back to the class and talk about your findings. So this is an attempt to hopefully encourage you to prepare for class with the lecture, the PowerPoints, and the readings, and we'll go from there. So this is for week one content. Of course, in week one, we are going to be covering the orientation PowerPoint the whole time. So this is the content. So we're going to be covering 5 chapters today: public health, nursing, and population health, the history of public health and community health. That's chapter 2. Chapter 3 is U.S. and global healthcare. Chapter 9 is evidence-based practice. And chapter 23 is health equity and the care of vulnerable populations. Okay, so I'm going to share my screen. Okay, I have each of the chapters pulled up and we'll go through these. First, I have your module pulled up. So, for example, I'm doing week one. Okay, so what is our reading for week one? And you can get this from right here in your module, or you can get it from the syllabus. Okay, so there's the 5 chapters we're going to cover, and you're also expected to have a look at Healthy People 2030 website. And I sent you a link earlier today with regards to Healthy People 2030 links for each week. So make sure you have a look at those. Okay. So I'm just going through the module, and here's your textbook. Everybody should have access to the Foundations textbook. Okay. And then for week one, you also have your professional development plan. So that will be due a week from today on Sunday. Okay. And you can take a look at the assignment overview. I'm going to be sending you a template of the long-term goals, short-term goals, present position. I'll send you a template for this professional development plan. Okay, I'll send that later. Okay, and just go through the assignment details and have a look and see what it is, and then please reach out if you have any questions. So that is due a week from today. Okay, so let's go into our content. And you'll be getting in an announcement later today the PowerPoints that go with the readings. Okay, so the first chapter we're talking about is public health, nursing, and population health. Okay, one of the important things to remember for each chapter is you first need to look at the objectives. Okay, because as it says with the objectives, after reading this chapter, the students should be able to. And we're going to cover these objectives in class. So it's going to be one of our class activities of being able to articulate the answers to these objectives. Okay, and if you've come to class prepared, and we break out into groups, I may ask group to each answer 1 or 2 of these objectives and then come back to the group and present these. So when you look at the chapter as a whole, obviously you don't need to know every single thing in every chapter, but what will guide you in your studying is these objectives. Okay, these objectives are what is reflected on exams. They're also reflected on the HESI. And these are the most important objectives for you to get out of each chapter. Okay, so I would encourage you to go to each of these sections and get the answers or do the reading that supports answering these 6 objectives. Okay. Okay, so this chapter covers the foundation for healthy populations and community. First thing you need to remember with community is the reason why this class is at the end of your program is you are taking all the concepts and all the in the classes that you've taken so far, and now we're pulling them all together and caring for individuals, families, groups, in communities. So we're moving the care from the hospital setting into the community setting. Okay, so you're also taking care of clients through the lifespan. You could be taking care of infants all the way up to the elderly. Okay, and when we think of community health, we think of community could be an individual in the community. It could be a family in the community. It could be a subset of a group in the community, say homeless, substance abuse, school nursing, could be a group of people in the community, or it could be the whole community. Okay, there's 2 important parts of community nursing to understand: what is community-oriented nursing and what is community-based nursing. Okay, community-oriented nursing focuses on the population as a whole, and we'll get into here. We'll get in the here. You're looking at the community as a whole and the wellness needs, the health promotion needs for community as a whole. So you're kind of getting oriented to the community. That's how I think about it. Where community-based nursing is focused on the individual or the group or the family, where you are actually taking care of the ill in the community. So you're based in the community. Okay. Public health has 3 core functions. Okay, assessment, policy development, and assurance. So please be familiar with those 3 terms. Okay, that's going to come up over and over again through this term, the core functions. Okay. Okay, the other thing that we're going to be talking about all throughout this term is primary care, secondary care, and tertiary care. Okay. So primary care, I use the P in primary for prevention. Okay, we are trying to provide care that's preventative. So education programs about the risk of obesity, education programs for bullying or in school. It's trying to prevent something before it happens. That's P for preventative. S is secondary interventions. And I have that S as screening. Okay, so secondary is screening. We are trying to screen for problems, maybe early identification, early intervention. Okay, we're trying to prevent something that may have already started from going into a full-blown disease or chronic condition. And then tertiary is treatment. They already have a condition. They already have, something's already happened. They already have a disease. So now we're helping them maintain that. It's not going to get any worse. We're helping them take care of what they have. So that's primary, secondary, tertiary. We'll address that every week. So you'll be familiar with that. Okay. Okay, we know that public health nursing is it's a specialty area, just like critical care nursing, just like OB nursing, like pediatric nursing. We have public health nursing. Okay, we know public health nursing is population focused. Okay, the emphasis is on members who are living in the community. Okay, or those who may be institutionalized in the community. We know that it's primarily community oriented. Okay, So we're working with the members of the community to carry out the core public health functions that we talked about above. Okay. We are trying to provide, as we do go through the nursing process, or the ADPI. Okay, we are trying to define what health promotion looks like, what health maintenance looks like, what disease prevention looks like. Okay, in the community. And then we may have target populations of people in our community that have certain characteristics of risk that we may need to be developing education programs or strategy programs with them. Okay. And I'd like for you to take a look at box 1.4. These are the principles of public health nursing. Okay. All right. We're trying to achieve the greatest good for the greatest number of people. And you have to be able to identify the differences between hospital care and community care, which is public health nursing. Okay, so I want you to have a look at the 8 principles of public health nursing. Each chapter in this book has a levels of prevention box. Okay, this is critical to review in each chapter. Okay, it's going to start to introduce you to um, um, primary, secondary, tertiary levels of prevention for whatever topic is being covered. Okay, so for this particular chapter, it's the introduction to public health nursing. Okay, so here's some primary, secondary, and tertiary prevention examples related to public health nursing. And the next chapter, which is the history of public health, the levels of prevention will be related to that topic. Okay, so we have primary, secondary, and tertiary are covered on all your exams and for all the different topics or chapters we're covering. So for example, let's do primary prevention for introduction to public health nursing. Use general and specific measures in a population to promote health, prevent the development of a disease. Okay, so it's all about prevention. Okay, so an example, the public health nurse develops a health education program for a population of school-age children that teaches them about the effects of smoking on health. Okay, they're not smoking yet, so we want to do a health education and try and prevent them from smoking. Okay, secondary, stopping the progress of a disease by early detection. So we're screening. All right, so thus reducing prevalency. Okay, so an example would be the public health nurse develops a program of toxin screening for migrant workers who may be exposed to pesticides. Okay, and if they have been exposed to pesticides, we're going to refer them to treatment to hopefully prevent them from, yes, they've been exposed, but we can reverse that instead of a full-blown exposure, which would be tertiary. Okay, so we're trying to stop the progress of the in this case, is the exposure to pesticides. Tertiary, stopping the deterioration in a patient, a relapse or disability. Okay, so they already have something. They already have had a stroke. They already have diabetes. So example, public health nurse provides leadership in mobilizing in a community coalition to develop a health maintenance and promotion center to be located in the neighborhood. Okay, and they're caring for residents with chronic illnesses. Okay, so they already have a chronic illness. So now we're working with them to help promote self-care, physical activity with the conditions they may already have. Okay. Here's a great summary of Healthy People 2030. This is a national program that started in 1979. We've gone through Healthy People 2000, Healthy People 210, Healthy People 220, and now we're at Healthy People 230. So there's a nice summary of what Healthy People 2030 is. Okay, we talked about public health nursing versus community-based nursing. So basically what this public health nursing is community-oriented nursing. They're used interchangeably. So we talked about the difference between community-oriented nursing, community-based nursing. Okay, community-oriented nursing, you're focused on the whole community. Okay, where community-based nursing, you're working in the community, focusing on individual care or family care or group care. Okay. And here's a nice table of similarities and differences between community-oriented and community-based nursing. So have a look at that. Nice detailed summary. Okay, and then I always like to go at the end of each chapter to the remember this section. Okay, you should be reviewing this after you read the chapter, review the chapter, you've answered, or this may actually help you answer the objectives. Read through the remember this section. Okay, it's a summary of the key points. Okay, so use this to help you understand the chapter and answer the objectives. Okay, and then there's lots of references at the end of each chapter. Okay, so that's your introduction. Okay, chapter 2 is the history of public health and public and community health nursing. Again, let's take a look at the objectives. Okay, after reading this chapter, you should be able to articulate this. And what historical events have influenced how current healthcare is delivered? Trace the ongoing interaction between practice of public and that of nursing, public health and that of nursing. What are some significant historical trends that have influenced the development of public health nursing? And then there's some key figures here that you should know about. Who was Florence Nightingale? Who was Lillian Wald? Who was Mary Breckinridge? And what were their influences on the current public health nursing? Okay, and so on. So these are the areas we need to focus on in this chapter. Okay. Okay, here's Florence Nightingale, page 21. Here's her whole story. Okay. Florence Nightingale's vision for trained nurses and her model of nursing education influenced the development of professional nursing and indirectly public health nursing. Okay. Goes on about Florence Nightingale. Who is Lillian Ward? Box 2.1 tells you who Lillian Ward was. Okay. Very interesting story of Lillian Ward. And it continues to go through the history. And Mary Breckinridge, here she is in box 2.2. Who was she? And what contributions did she have to public health? So I just need you to have a general summary of these three profound figures in public health nursing and what their contribution was. I'm skipping through a lot of this. I get that, but you should be previewing what areas you need to read based on the objectives. Okay, here's another good summary of Healthy People 2030 that I would encourage you to read on page 32. I do want you to have a look at this box in each chapter as well. There's 3 boxes I want you to look at in each chapter. One is the primary, secondary, and tertiary box, which we talked about. The second box is QSIN. Okay, QSIN these are nursing competencies. Quality, safety, education, and nursing. That's what QSIN stands for. Quality, safety, education, and nursing. All right. I would like for you to read through each box because each chapter talks about a different competency. Okay. So here are well, actually, this chapter introduces CUSIN. Okay. These are the 6 CUSIN competencies of nursing: patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. You will get asked about this on the exam. Okay. 6 quality and safety education for nurses competencies. Okay. So I need you to have an idea of what these 6 are. These direct our competencies, direct our practice. So each chapter going forward will take one of these 6 competencies and they'll address it throughout the chapter. Okay, this chapter 2 introduces what CUSIN is. Going forward, each chapter will take one of these 6 and work through that. So really important to read this box about CUSIN. Okay. And then you remember this. Okay, your summary of the chapter. Okay, it talks about Florence Nightingale. Here's her summary. Lillian Ward, here's her summary. Mary Breckenridge, here's her summary. Okay, so have a look at that. Chapter 3 is your U.S. and global healthcare. And again, you'll get all the PowerPoints to these chapters as well. And remember, the PowerPoints are essentially a summary of the chapter. And actually, to be honest, if you look at the chapter outline for each chapter, that's how the PowerPoints are organized. Okay, so actually for each chapter, the chapter outline is your PowerPoints with some additional detail in them. Okay, and your chapter outline is also how the chapter is laid out for you. Okay, and they're all hyperlinked. So if we look at let's see, discuss key aspects of the private healthcare system. Okay, let's go up to the outline. Okay, let's see, just private healthcare system. I'm looking for the no, public health to primary care. Okay, let's look at that one. Public health to primary care. C, or number 3. Well, if you just click on primary care, it's going to take you right to that section and talk about primary care, okay, as per your objectives. The other thing I'll point out, and I should have pointed this out in the chapters before, if you have words in your objectives that you don't understand, okay, or words in the chapter you don't understand, click on, these are all hyperlinked as well. You know, what's population health? What are determinants of health? Okay. It hyperlinks you right down from the outline as well as the key terms. Okay. So if you follow along with your PowerPoint, this is what you're going to get, your chapter outline. And of course, the rest of the chapter is just more detailed information about your chapter outline. So again, you should come to class prepared to answer these questions. That means you're prepared for class, and you can, when you get into your breakout groups, you'll be able to answer these and help the rest of the class understand as well. Okay. So what do we know about healthcare in the United States? We know that the United States spends the most of any country in the world on healthcare. That's just a fact. Okay. Have a look at the demographic trends. Okay, what are the demographic trends for global healthcare? All right. We know that this is important. The population of the world is growing as a result of two things, two main things. One is changing fertility rates, increasing fertility rates, and decrease mortality rates. Okay, so if you're asked a question, oh, the population of the world has been growing for the last 20 years, why? Well, primarily it's due to increased fertility rates and decreased mortality rates. Okay. Here's some social and economic trends for global healthcare. Okay. So we know that in addition to the size of the population, age distribution of the population, other factors, we know that changing lifestyles, appreciation for the quality of life, changing the composition of families, living patterns, household incomes, they're all defining what quality healthcare means. The health workforce trends in healthcare, right? We know we have our ebbs and flows in healthcare workforce trends. When I became a nurse 40 years ago, it'll be this May, it'll be 40 years, there was an excess of nurses. It was hard to find a job. Okay. It goes in cycles. Okay. The predictions are in the future for a huge percentage of nurses to be retiring in the next 5 to 7 years. How are we going to fill all those spaces? How are we going to fill all those gaps? And then the updates and innovation with technology. That's certainly playing a factor in healthcare trends. Okay, look what's happened over the last couple of years with the pandemic. Telehealth has opened up lots of new clinical opportunities for nurses and their clients, or especially in the rural areas, managing chronic illnesses, right? Providing health care, rehabilitation, and long-term care through telehealth. Okay. Okay, so here's a couple of sections to be familiar with. What's the current healthcare system in the United States? Well, we know the cost is an issue. And I just need you to know what the issues are. Cost is an issue. Access is certainly an issue. We'll be talking about that throughout the term. Quality of healthcare is an issue, right? So I want you to know those three. Cost, access, and quality are the three main issues with the current healthcare system that we have. Okay, what kind of systems do we have? Okay, we have a primary care system. Okay, read through that. We have a public health system. And we have a federal system. Okay, so just be familiar with those three types of organizational groups that make up our healthcare system. No, just know what each of those mean. What is a primary care system? What is a public health system? What is a federal system? And then certainly we have healthcare systems at every level. We have a federal system, which is what is it? Department of Health and Human Services, HHS. Okay, that's our federal system. Then we have state systems. Okay, we have state health departments. We have local health departments. Okay, so federal, state, local. Here's our levels of prevention box related to this. This is about the public healthcare system. So our levels of prevention are related to this chapter. Primary prevention, implement a community level program such as walking for exercise to assist citizens in improving improving health behaviors related to lifestyle. So we're trying to prevent any problems before they happen. If we can get a walking program organized, maybe it will help them maintain a healthy lifestyle. Okay, secondary prevention. Remember, this is screening. Implement a family planning program to prevent unintended pregnancies for young people at the local health center. So we've identified maybe a group, maybe teenagers. We've identified a group that may be at risk for unwanted pregnancies. So let's do a family planning program for our at-risk group and see if our teaching can prevent them or have them understand the challenges of teenage pregnancies. Right? So that's early screening, early intervention. We've identified a group at risk and we're trying to provide early intervention. And then tertiary, provide a self-management asthma program for kids with chronic asthma to reduce the need for hospitalization. Why is that tertiary? Because they already have asthma. Remember, tertiary is treatment. Tertiary is testing, treatment. Right? They already have asthma, so we're trying to help them manage their asthma. Okay? And then this goes through and goes in a little bit more detail about primary healthcare. Okay. Not going to worry about that. Every chapter, here's the third box I want you to review in every chapter. So we have the CUSIN box, the competencies, quality and safety education for nurses. That's our competencies. We have the levels of prevention box, primary, secondary, tertiary. And the third box you'll need to review in each chapter because there are several questions on each test that are regarding this is the Healthy People 2030. Okay. These are specific to each chapter as well, just like the primary, secondary, tertiary interventions, where they give you examples pertaining to the topic or chapter or concept we're covering. Well, so does Healthy People 2030. Okay, so here's their selected objectives that pertain to strengthening the public health infrastructure. That's what this chapter is about. And they will give you anywhere from 3 to 6 or 7 bullets on what their stated objectives are pertaining to strengthening public health. And remember, this is a national initiative. Okay, so when you read these goals, yes, they are broad, yes, they are general, but they're applying to all of us. Okay, they're national objectives. Okay, so have a look at that. Okay, here's your CUSIN box. Okay, so I told you, well, in chapter 2, they talked about what are your 6 targeted competencies. The last one was informatics. So this chapter, they're taking the competency of informatics and they're showing you how to apply this competency within this chapter. Right, so the targeted competency here is informatics. They're trying to help us understand how we use information and technology to communicate, manage knowledge, mitigate error, and support decision-making. Okay, and every CUSIN box from here on out is going to have a targeted competency. It'll be one of those 6 that was introduced in chapter 2. And each of them are going to go through the 3 important aspects of whatever competency it is. This one is informatics. So knowledge, skills, attitudes. So knowledge with regards to informatics, identify essential information that must be available in a database to support interventions in a healthcare system. Skills to acquire for this competency, use information management tools to monitor outcomes and intervention processes. Remember, we're talking about informatics. Attitudes, value technology that supports decision-making, error prevention, and case coordination. This is really good knowledge to become familiar with these 6 core competencies. Okay, and then it gives you a question, it gives you the answer, something to think about it with regarding the informatics competency related to this chapter. Okay, and then you get down to your remember this. Usually the most important bullet points from this chapter. Okay. Next chapter is evidence-based practice. We need to know what evidence-based practice is. Okay. So here's your objectives for this chapter. Describe evidence-based practice. Understand the history, right? Understand the relationship between evidence-based practice and practice of nursing. What are some examples of evidence-based practice? What are some barriers? Okay, so again, you have your chapter outline. Okay, your first objective is define evidence-based practice. Well, the first section of this chapter is about what is the definition of evidence-based practice. Okay, another objective was identify barriers. Well, if you go to your outline, there's a whole section on barriers. Okay, so again, start with the objectives. Look at the course outline. Does it have a hyperlink to that objective that you can read about? Then maybe look at if you start reading that section, there's keywords you don't understand. Evidence-based practice, look it up. We all know what evidence-based practice is, right? It's best practice. Okay, we as nurses are using the best evidence, the best research, the best knowledge, the best clinical competencies we have to provide the top-notch care to our patients. Okay, we use the best knowledge in making our decisions about individual clients. Okay, as public health nurses, we need to be informed and we need to stay on top of a variety of advances, whether it be research, clinical trials, epidemiological studies, journals. Okay, available evidence from a variety of sources, research, nursing experience, and expertise. And we look to our community leaders as best practice, cardiologists, neurologists. Okay. We don't really need to know about that evidence or the history of it. We need to know, here's some types of evidence that we could be using. RCTs is random controlled trials. Okay, so this gives us a list. No matter what definition of evidence-based practice is supported, okay, there's a hierarchy of evidence that we use, ranked in order of decreasing importance and use has been accepted by professionals. Okay, so we start down here, or we'll start up here. So the double-blinded randomized control, the RCT, ranks as the highest or the best level of evidence. And it goes down to non-randomized, quasi-experimental, case-controlled. Okay, so these are different types of evidence, right? And then nurses would argue that the hierarchy ignores the evidence gained from clinical experience. Okay, so the nurses have added this hierarchy evidence that they feel would need to be supported by experts to gain the appropriate expert knowledge. Articles, professional guidelines, national organizational opinions. Okay, the nurse's clinical expertise. Okay, so we know that evidence-based practice represents a cultural change in practice. Okay, it provides an environment to improve both nursing practice and client outcome. Okay, as nurses, we're known for providing care based on the following. Okay, observations, assessments, Hypotheses, collecting data. This is our ADPI. History, physical assessment, review of health records. Okay. What are some barriers to evidence-based practice? Does anybody work with anybody that says, oh, we don't really need to implement this change. We've been doing it like this for 20 years and it's just fine. Okay, so attitudes play a big part. Okay, if the staff's not committed, they're not going to practice it. Okay, so we need to get people on board. How do we get people on board? We try and promote it from a client standpoint. Right? It respects the cultural value, the client's values. Okay? It cultivates the spirit of inquiry. It's asking clinical questions, searching for the best evidence, taking a look at the evidence, integrating the evidence. Okay, here's our level of prevention box based on evidence-based practice. Okay, so according to evidence collected by the Community Preventative Services Task Force, the following interventions support the literature at each of the levels. Okay, so what would primary be? Remember, we're trying to prevent. Primary prevention, extended and extensive mass media campaign to reduce youth initiation to tobacco use. So again, we're trying to prevent something before it happens. Okay. Secondary, screening, early intervention, early identification, client reminders and recalls via mail, telephone, and email, or a combination, are effective strategies in compliance with screening activities, such as those for colorectal or breast cancer. Right? So reminding people their mammograms due, reminding people their primary care appointments due, reminding people we're trying to identify who may be at risk, contacting them early, and reminding them they have to come in for a visit. So we're screening. And then tertiary, they already have something. So in this case, diabetes self-management education and community gatherings to improve glycemic control. So we may be working in the community with a group of clients who has diabetes, and we're doing community outreach to help them improve their glycemic control. They already have diabetes. Okay, and here's your QSIN box. Remember, your QSIN is your competency. So what's our targeted competency? There's 6 of them that can be used. Last chapter, we saw informatics. Now we see evidence-based practice, which is one of the 6. Okay, so read through what are the important aspects of evidence-based practice. There's 3 of them. They're all the same in each chapter. Knowledge, skills, and attitudes. See how those are applied to evidence-based practice. And they give you a good clinical question and give you the answer to it. Don't forget to review that box. Okay, and then the 3rd box is your Healthy People 2030. Okay, so their goals in this chapter, information access is important to ensure clients and communities have correct information to make evidence-based practice healthcare decisions. So here are the Healthy People 2030 resources. Here are their objectives related to evidence-based practice. So please be knowledgeable of those. Okay. Remember, here's another reminder of core public health functions, which are remember your 3 core public health functions: assessment, policy development, and assurance. We did that in chapter 1. Okay, and here's some examples of how evidence-based practice is integrated into these 3 core functions. And then here's your remember this. Okay. So there's the first 4 chapters. I still need to go through chapter 23, but I'll do another recording for that or I'll cover it in class. I hope that helps. These are pre-recorded content lectures that are pretty much a summary of what we're going to be covering. So that is for week 1. So thanks and look forward to seeing you in class this week. Okay, bye.